1079 CDY. This is Cadillac Unscripted. This is Rich Spicer along with my partner Katie Huckle, who is actually off this week. So we're going to fly solo today. And I'm in good company because we have Dr. Jim Whelan with us. He is the Chief Medical Officer for Munson Healthcare Cadillac Hospital. Hello, Jim. How are you?
I'm great today, Rich. How are you?
I am fantastic. So where do we start? What's life been like? Because we're going on very close to the 10-month mark of COVID-19 actually having disrupted our lives on so many levels. Let's talk about how life is different for a doctor in this era.
Yeah, I agree with you. Unprecedented disruption, and the way things have changed, I think there's been a lot of permanent changes, but we've really ridden quite a roller coaster in the private practice world. We have gone from seeing everyone virtually for a couple months to continuing to see most sick people virtually. Some offices have modified their practices or their buildings so they could see sick patients. All of us have added on virtual visit capabilities so we can continue to take good care of our patients without putting them at risk. We've had to change the way we interact with payers and patients as well, just to help ease a little bit of the burden on both those patients and on those practices because of such a reduced volume.
You touched on something just as you were starting to answer that question. You talked about how there are changes that were necessitated that may stick after the vaccine is widely distributed and this is largely over with. What kinds of things will change permanently?
Well, statistically, we know that before the pandemic, only less than 1%, considerably less than 1% of primary care visits were done virtually. Almost all of those were done kind of in an urgent care sense of someone wanting to avoid having to go to the urgent care ER and hoping that a telephonic visit would address their needs. I think that number will be at 10 times that number. 5, 7, 9% in general practice in the future. And in some specialties, it'll stay quite a bit higher than that. We've found that in behavioral health, virtual care is excellent, and especially for us geographically, with so many people so widespread and oftentimes driving difficult, especially for older patients, I think some of their chronic care will remain virtual going forward.
And you see that as a good thing?
I believe that in many instances we can do safe, effective care for patients virtually. We will always use it as a little bit of a triage option. So there will be some of those visits that we say, I really need to listen to you, or I really need to push on your abdomen, so I need you to come in person. But for some things, we will be able to safely evaluate and advise just with a virtual visit.
And that makes things so much easier for, as you mentioned, for those folks who have those long drives. So I guess my next question for you, Dr. Whelan, is our response to COVID-19. Obviously, things have changed so much. So many people have been, their lives have been disrupted. Livelihoods in many cases have been disrupted. Where do we stand in the fight? So let's talk about a 9-inning baseball game. So 9 innings being the end of the game. Have we reached the 6th or 7th inning by now?
I would say we have. We're at the 7th inning stretch. That's a great analogy.
Okay.
And I'm very comfortable with the 7th inning stretch comparison. I would say that we are in a nice kind of stable place. The end result is visible but still uncertain, and we still have a lot of work to do to kind of win the game. But the the worst part is behind us and slowly fading.
And I think people need that. They need that sense of hope. I think there was, for much of 2020, kind of a sense of hopelessness. And it's good to be able to see the light at the end of the tunnel, don't you think?
Oh, I agree. I've been telling people, my patients, my friends, myself, that I believe this summer will be the best summer of family reunions ever, because I think we'll feel safe, especially to gather outside in small to moderate-sized gatherings by summertime, and can do so without fear of risking our grandparents' lives or others, and not having the chance to cause super spreader events, because we'll have a high enough percentage of people who are immune that we can really start to get back in touch with each other, which is really where we've suffered between uncertainty and loss of contact. That's been the most painful part of this.
I agree. And for those of us who are huggers, it's been miserable the last 10 months. You know?
Yeah. Oh, I mean, it's our family. It's so many things that little bit of human touch makes such a huge difference. And to feel like it's dangerous to do that has just been so uncomfortable.
Yeah, it has been. So when we're talking about, family reunions and events and things going on this summer, it sounds as though there's hope that decent-sized gatherings outside are going to be okay, but maybe indoor gatherings are still going to be a little iffy, and we should hold off on those. Is that kind of what I'm getting out of what you're saying?
Yeah, so much depends on vaccine supply and really no surprises in the virus's behavior. But I believe that by beginning to middle of summer, we'll have started nudging up against herd immunity between those who have had the virus and those who have been vaccinated. And we'll see very low numbers in our community spread, and any restrictions on gathering will start to fall away. Spring, we're not going to be there yet. We're not going to be able to have 100 people at a wedding in April. But by August, we probably can have 250 people at a wedding. Now, this is Dr. Jim Whelan's guesses based on just spending tons of time reading about it and kind of trying to use a crystal ball. So please don't hold me accountable if I'm wrong.
Right. Yeah. Well, and you're probably looking at the statistics that we have now, and probably there's a lot of extrapolation going on, I would imagine, in that opinion.
Exactly.
Yeah. Yeah. So an update on the vaccine itself. You mentioned surprises. Have there been any surprises, anything that you didn't expect to see as we have seen the Pfizer and the Moderna vaccines rolled out over the past few weeks?
No surprises. So there's a lot of publicity about vaccine reactions. I don't think any of that's really surprising. I think that really, we see that in all vaccines. Mm-hmm. So most of us as adults, maybe once a year flu shot, several years between our other vaccinations. So we're not really as aware of it. But we see a lot of reactions to vaccines, like sore arms and achiness and things like that, which we're not seeing drastically abnormal numbers of that with the COVID vaccine. So that hasn't been a surprise. I think that if I had a surprise, it was how many people are still hesitant about getting the vaccine. And so that, I think, those of us who are kind of in the trenches had on blinders and didn't really expect that much kind of hesitancy.
Or pushback, if you will. So,
yes.
So what would you say to someone who says this was rushed to market? They've in the past they've had years and years of research that goes in, and this wasn't enough time. How do you quell those thoughts for those folks who are reticent to have the vaccine?
So I use these two major arguments or explanations, really more than arguments. The first is that the technology used to create this vaccine is not new. They didn't have to come up with something completely, unprecedented to make a new vaccine. We've had the machinery, and my kind of analogy is that all we had to do was identify what the ingredients to put in at the beginning. So what was the viral code that we needed to put in at the beginning? And then we had processes that made the vaccine already in place. So that was relatively simple. It would have worked the same no matter what we were making a vaccine to. It didn't take any longer or any shorter to do that. It was maybe slightly accelerated because these large companies, Pfizer, Moderna, they devoted tons of resources and tons of super smart people and teams to doing this work exclusively. So it is a little bit of trial and error. So those of us learning to bake, we put in different ingredients, and if we don't get them quite right, the cake's not really awesome at the end. But by the 10th cake, oftentimes it's great. So that's kind of how we got to the vaccine. But then what really went faster and makes this feel too fast to us, but maybe really isn't, is the testing. And these vaccines have gone through all the normal stages of vaccine testing. What's been faster is the last phase, the large-scale human tests. And I use this kind of example. So to prove that something's effective, you need a certain number of people in the vaccine and placebo groups to actually get exposed to the virus and either get sick or not get sick, to show that those who are vaccinated are protected. If I'm making a vaccine to Ebola virus and I still need 30,000 people to get exposed, that could take years because it's rare, it's very isolated, and the number of potential exposures is very small. But if I was testing a coronavirus vaccine during the peak of the surge across the country and across the world, it did not take very long to get 30,000 people exposed. They did the tests in the hot spots like Brazil and the parts of the United States that had very high spread, and so it was very rapid for them to start to get tens of thousands of people who were exposed that then they could analyze their reactions and feel safe statistically, scientifically, that this vaccine was effective. And that's really what happened so quickly and why it feels too fast.
Well, that is a very comforting explanation. I know a lot of people are very worried about after effects and side effects and things like that. And I can tell you, Dr. Whelan, once upon a time I had a flu shot and I got sick, and I was sick for about 3 or 4 days after that flu shot. But that's the only time that ever happened. It just happened once to me. Are you, for those who are going to have the vaccine, are you advising them to maybe be prepared to take a day off after the day after from work, or what are your thoughts on that?
It's very interesting you asked that today, Rick, because we had this conversation at all our leadership meetings today. Because we're rolling out the second dose, and the second dose has a slightly higher percentage of reactions, we have added in the recommendation that you be prepared to have the day off, the day after off.
Okay.
Not because you really couldn't work, you're not contagious, but because a high enough percentage of people are feeling crummy, and we're already a little tight on staff still as a consequence of all this virus and the shipping of everything. So we're just trying to be a little more aware of it. For the average person, if you are just going about your everyday business, you might feel slightly off, but you'll be able to function. But if you have to function at a high level, you should consider just be prepared in case you need that next day off.
And with that, Dr. Whelan, we're going to take a break, and we're going to talk a little bit. We're going to get an update on the vaccine and where we stand as far as who's getting it now, what group is up next, and kind of where we go after that. We are with Dr. Jim Whelan, who is the Chief Medical Officer for Cadillac Munson Healthcare Cadillac Hospital, and we will continue on Cadillac Unscripted with Dr. Whelan next on 107.9 CDY. Cadillac Unscripted is sponsored by Independent Bank. It is Cadillac Unscripted on 107.9 CDY. Rich Spicer flying solo, Katie on vacation this week. And we've got Dr. Jim Whelan with us. He is the Chief Medical Officer from Munson Healthcare Cadillac Hospital. And obviously the topic today, Jim, has been the COVID vaccine. And we covered a lot in the first segment, but what we didn't cover in the first segment is something that's on a lot of people's minds: the continued rollout and the priorities, the groups who have been put in certain priority lists, and where do we stand now? Who is getting the vaccine now? Who is next? And how is that going to look? And how long will it take, do you think?
So, thanks, Rick. This is a great question, and really important we get this information out there. So first I want to celebrate some real positives. So it is today the middle of January, and we are, I believe, 4 to 5 weeks into vaccine distribution.
Okay.
So that's really fast. We have not been doing this very long. And in the Munson footprint, so this northwest corner of Lower Michigan, we have given between 15 and 20,000 vaccines. That is a very significant proportion of the total vaccines given in the state. So we are getting it and giving it out as fast as we possibly can. And we're all impatient. We all want to have this vaccine and be able to start to feel safe. But we are way ahead of where we thought we'd be even a month and a half ago. So let's celebrate a little bit of the positives.
That's
departments.
That's really encouraging. That's encouraging, Doctor, to hear that you're actually ahead of where you thought you would be.
Yes, and the health departments are doing their very best. The hospitals are doing their very best. Walgreens and CVS are doing their very best, and we've got some great milestones. Healthcare workers, those who are wanting to be vaccinated, have all had that offered to them. Many have already gotten their second dose. Long-term care facilities are in the same situation. Most, if not all, have already received their first dose, and some have already headed towards their second dose. So that's Group 1A, long-term care facilities, healthcare workers. There are still some gaps that haven't been completely filled. Many of those were not what you traditionally think of first as healthcare workers, and so the health department is catching up and closing those gaps. And there's still a few smaller long-term care facilities that have their vaccines scheduled but just haven't received them. Our next phase will be 1B, and the state kind of threw us a curveball when they announced that we should immediately move into 1B with those 65 and over. That announcement is great. We support getting those people vaccinated as fast as we can. It did not come with 20,000 doses of vaccine. So that created a crunch that's required a ton of collaboration between the health departments and Munson Healthcare. But we have essentially scheduled appointments for all of those that we have doses for. That is still a minority of that age group. And so there's a lot of clamoring for when are we going to get it next. The rest of 1B are also curious. That's our teachers, our police, emergency workers, things like that. Those groups, and you can watch the news. In some counties, they've already started those groups. In other counties, they haven't yet. And that feeling like someone's ahead of me in line is very uncomfortable for us. But we are shortening the line as fast as we possibly can. So I would urge patience. The great thing is that we expect the United States to release a large amount of vaccine fairly soon, and we have all the infrastructure in place to get that to people as quickly as possible. So right now, essentially, go ahead, I'm sorry.
Yeah, a question. You know what? I'll let you finish your thought, and then I'll ask the question. Go ahead.
Sure. So right now, basically every vaccine dose we have received in Northwest Michigan is accounted for. An appointment's been made for someone to get that. We are actively working with our health departments to prioritize whoever would be next for this, the next delivery, and to try and do it consistently across our area. So that will be the rest of our patients, 86 and above. So those lists are generated, those people are being contacted, and we will be scheduling those clinics very soon, along with starting to reach out to get all of those other 1B non-patient groups. I expect that by the end of January, we will be well into the 1B group, and that by the middle of February, we will be mostly finished with the 1B group. The challenge will be perhaps some of the over 65 patients, because it's when we start saying Americans over 65 in our area, it starts to be a pretty big number.
Mm-hmm.
So how fast we can get through them will be highly dependent on how much vaccine we actually get. So we'll stay optimistic that we're going to get a lot, and that by the middle of February, most of 1B has already gotten their first shot. That is possible, maybe a little idealistic, but not completely.
So how are vaccines shipped out? Do the people who are in charge of that kind of have an idea of how much of the population in Wexford County as opposed to the population in Wayne County? Is it all divided out according to population and the need for it? How are these vaccines making their way north?
So the state is in charge of that distribution, and it is largely population-based.
Mm-hmm.
To stay fair.
Right.
Then each vaccination kind of group, hospitals or health departments, have kind of had some flexibility in terms of how they prioritize things inside of each 1A and 1B group. So that's why we have a little bit of variability. In terms of how people are being connected to this, so how do I know that it's my turn? Or how do I get on the list that I need this? Most people can trust that their primary care physician is aware of who's eligible and is connecting them to the appropriate source, whether it be the hospital system or the health department. And we are in daily, every single day there's a meeting with all those Munson healthcare departments and the Munson hospital systems to make sure we're not letting anyone fall through the cracks and that we're well aligned in how we're rolling this out. Most likely you will hear from your primary care office or from the hospital for when and how to sign up. The health department did, when they first opened up to 65 and above, opened up a web scheduling opportunity, which essentially filled every slot very, very rapidly. Before many people even knew it was open, it was already full.
Mm-hmm.
It's like trying to buy concert tickets in the good old days. And
except you can't scalp the price of a vaccine, doctor, though.
I wonder if that's ever happened. You wonder, hey, I got a slot available, $20. I don't know that would happen. I don't think anyone would do it right now.
No.
But that's kind of how it's rolled out. But we will get through everybody. It's going, after 10 months, we're all ready for it to be over. But we are really looking at, 4, maybe 6 weeks for second doses, maybe 7 weeks for the vast majority of those people who are at our highest risk, which to us in the hospital system is very reassuring. It just, all of us would like it to happen even faster. But it's rolling right along.
Just to know that we are far closer to the end of this than we are to the beginning is comfort enough in itself, I think.
Yeah, we're vaccinating in this area maybe 1,000 people a day right now, but we have a little kind of lull in the vaccine supply that'll impact next week, and then we're optimistic that within 2 weeks there'll be a large distribution, and by the end of the month we'll be really opening up a lot of clinics.
So what you're telling me is if you are on the list, the 1B list, the one that's next to get the vaccine, Don't call your primary healthcare provider. You're supposed to wait for them to call you. Is that what I'm hearing?
Yes.
Okay.
So we originally communicated, let us know you want to be on the list. But we have everybody we know is on the list. And so we are advocating to get our patients, onto the correct list. Part of the reason is that the hospital and the health department every day at their meeting kind of redistributes who's responsible for what. So they tell each other what they got done, and then they decide, okay, you take care of everyone over 90 in these counties, we'll take care of everyone over 90 here, or you take care of the teachers and we'll take care of the 80-year-olds, or they're making that decision, and it's rapidly changing. And so the best way to get information is from your primary care doctor. So when they decide, it goes to the primary care doctors. They start getting their people in the right line, essentially.
I gotcha. Okay. So it's coming, and essentially what you're saying is be patient. We will get to you.
As fast as we possibly can. No one is sitting on vaccine up north. Like, we don't have thousands of doses that we're kind of like, well, we'll see. No one's doing that. We are trying to get it all, as they say, vaccine in arms, not in fridges.
Yeah, you know what? Speaking in fridges, let's talk about that for a second. What kind of special storage have you had to line up? Has the medical groups had to line up for? Especially I hear the Pfizer dose has to be really, really cold. Is that correct?
Yeah, like minus 80 Celsius or something. So each of the Munson hospitals had to buy a special super chiller. I don't even know what the name of it is. Super chiller freezer or something. I don't know. And to store that. And that's why that was distributed primarily to the hospital systems. The health departments were also able to do that and got a subsequent Pfizer dose. Moderna, much more tolerant in terms of storage, more normal refrigeration freezers. And that is likely the one that when vaccine supply is high enough, it will also be distributed to the primary care offices. All of our community primary care offices applied for and were approved to be vaccine distribution sites. The only thing keeping the offices from actually being able to give the shots is they've not been allocated any doses yet.
I gotcha. Okay. All right. So time elapsed from first dose to second. The medical recommendation is what?
Pfizer is 21 days and Moderna is 28 days.
So 3 weeks or 4, essentially.
And we are trying to get as close to those days as possible. We know from the long history of vaccine use that exactly 21 days or exactly 28 days is unlikely to make a big difference if it's a day or two off. In fact, many vaccines, it can be 9 months difference. But we're never going to let that happen. But if it's a couple of days off, no one should worry at all that they're losing any efficacy.
Okay. Well, this has been extremely informative, and I hope comforting for a lot of folks.
I hope so. I mean, this last month has been by far the most hopeful for those of us in the trenches as we've seen in 10 months. We have seen a slight increase, not slight, a moderate increase in the number of patients in the hospital since the Christmas, New Year's holidays, and we expect that to continue for another week or so, but not certainly as bad as it was at our peak. And the fact that we're giving vaccine to all of these vulnerable people really is reassuring for those of us in the healthcare arena.
Last question. The two new strains that we've been hearing about on the news, these doses, these vaccines are still effective against those new strains, Doctor?
Yes. So we'll know more, like every day we're learning more about these strains. Again, it's the number of available cases to study and compare that there's not that many yet in the United States. So we are learning more every week, but there's nothing different about the structure of the virus that the vaccine targets that should make them resistant to the vaccine. They spread more quickly, but they do not make you sicker. They are not more fatal. They just spread more quickly.
Great information to know. Dr. Jim Whelan, Chief Medical Officer from Munson Healthcare Cadillac Hospital, presenting us with a ton of really good information here in the last half hour on Cadillac Unscripted. Doctor, thank you very much for your time today. We really appreciate it.
Yes, and if you get lots of feedback, Rick, I'll be happy to come back anytime.
Sounds good. Thank you very much. Cadillac Unscripted is sponsored by Independent Bank on 107.9 CDY. Back with more local chat 1 week from now, same time, same station, 107.9 CDY.